Welcome back to Inside Politics. Our guest today is State Senator Steve Dickerson. He's part of the Nashville delegation, the only Republican who serves in the state Senate from Nashville in many years, I think.
Correct.
Senator, we talked a lot about your birth control bill, making it available under the counter or behind the counter instead of by prescription. Another piece of health care legislation that continues to get a lot of talk up on the Hill, even though it was rejected twice last year by the legislature, is expanding the state's Medicaid system for the working poor under the Affordable Care Act, which you talked about earlier. It's called Insure Tennessee. Have you been supportive, or are you opposed to what the governor wants to do? Would you like to see the program revived and be considered?
I'm very supportive of getting a dialogue going and trying to see if we can get the bill up for a vote. Some of the specifics have not been worked out, and frankly, there's some wrinkles involved with it that I'd like to see really worked out through the legislative process, and then get it up and have everybody get a chance to consider it.
But as a physician, we're talking about hundreds of thousands of Tennesseans who don't have access to health care. That certainly is something that you'd probably like to see taken care of sooner rather than later, right?
But I do think there's a need for Tennesseans to have access, and this is one opportunity.
We've got people who are likely to die over the time, though, while we're working out all these details. There doesn't seem to be much interest on the Hill. I mean, your leader in the state Senate, Lieutenant Governor Ron Ramsey, says he doesn't want to think about it again until after a new president's elected. He hopes that the Affordable Care Act becomes a voucher program to states, not that. But I mean,
a block grant.
Aren't human lives more important than a presidential election?
They are, but this is a political process, and as attractive as it may be to be nimble and quick and operate like a jet ski, the state government operates more like an aircraft carrier, and sometimes it's just very slow.
But the governor negotiated this for 2 years with the federal government, maybe longer, and certainly the Affordable Care Act has been on the books now for 3 years. Why is it so difficult to get these details worked out? Doesn't that bother you as a physician? It would take that long to figure it out?
I would like to see us be more efficient and more nimble with a lot of areas of public policy.
Another medically related bill that you are sponsoring would allow medical marijuana to be given to the neediest Tennesseans, I believe, as you put it in an op-ed piece you wrote. What do you mean by the neediest? Is there some reason to believe that we'd have more people who are in dire straits financially that would need medical marijuana? Well,
I would say neediest may be one description, but sickest is the one that I'd use. And so the bill, as I introduced it, would take not smokable marijuana, but derivatives. It'd be oils, ointments, capsules, things like that, and provide them or make them available for people with some very specific illnesses, things like end-stage cancer, things like neuropathy, multiple sclerosis. You cite some numbers in the op-ed piece that I've seen from your office about the number of Tennesseans that are touched by cancer alone that might be able to be helped by medical marijuana. Can you talk about those a little bit? And is this just to allow this to be done for cancer patients, or are there other diseases that also might be helpful? Right. There are a number of diseases, and frankly, the data is evolving on that even as we speak. And so what would have been a list of 2 or 3 is probably up to 5 or 6 different illnesses. Cancer is the most obvious one, and the one that I think touches the most Tennessean lives. And so that's an obvious one to kind of lead with. Medical marijuana is not a cure. It merely lessens the pain and suffering that's involved with the disease. Is that correct? Correct. I'd call it more of a palliative therapy. And Tennessee is behind a lot of other states in this regard. We're starting to see a lot of states adopt the ability to be able to have doctors and patients use medical marijuana. That's correct. Currently about half the states in the union. But now, even if Tennessee does that as the other states, how do they get around the federal law? The federal law still doesn't allow for the possession of marijuana or the use of it in any way. It's still against the law, is it not? That's correct. It's still a Category 1 medication or drug, and the federal government doesn't actually recognize any benefit technically to cannabis. If you look at what they've done, though, they've actually defunded federal enforcement in states that have medical cannabis, and so in those states, people who are engaging in medical cannabis are relatively protected. Now, the concern, at least I hear up on Capitol Hill, is, well, yeah, this is great. It'd be great to lessen the pain and suffering for people, but we're concerned this is going to still wind up being somehow diverted and being used for recreational purposes. How does your bill address that kind of a problem? Right, and so that's the camel's nose under the tent argument to an extent also. So this bill is very specific in that you must have a specific illness, a specific diagnosis from a physician that is going to be on a list that is going to be promulgated by the state, and people outside that list will not be eligible eligible. Frankly, I think the expense of this medication is probably going to make it not all that desirable for just a routine sort of recreational use.
Is it covered by insurance?
It will not be. I do not know of any plans that currently cover it, so there will be an out-of-pocket expense associated with this.
And how do we know that being able to use marijuana in this way somehow does lessen the pain? What kind of studies have been done? Aren't they kind of difficult to do studies that can quantify it?
Right, and that's a great question. So in the United States, since it is not recognized as having medicinal benefit, studies have been very, very slow to be run. Currently, though, there are a lot of studies that have recently been published, and for example, nausea in patients with severe cancer, this is considered to be the second or third line medication as a result of those studies.
Last year, it appeared your bill was getting a little bit of momentum. It was sent off to a summer study session, but when the study session actually came into being, it appeared that your opponents were ready for you, and they really have, and particularly the Haslam administration, very strongly opposed to this, very much worried this is somehow going to be some kind of a starter or gateway drug for people to start on this and then move on to cocaine and heroin. How do you react to that?
Well, the summer study, the purpose of the summer study was not to get a vote on the bill. My purpose of the summer study was to find out what the opponents really felt and what their arguments were. And I think they really
I guess now you know.
I do. They laid their cards on the table for us. And so it's my job as a legislator to take as many of those concerns and answer them in the legislation and make it as palatable for them as possible.
Lieutenant Governor Ramsey said he doesn't think this kind of legislation has a prayer. So what do you do to change his mind about this so that you just have some possibility of even bringing it to the floor of the Senate someday?
Well, I'd say there are two strategies. First of all is a fact-based strategy where we cite studies, we have experts come in, we have people who have scientific data that can substantiate our claims. The other one really is sort of the anecdote. There are thousands of Tennesseans who will come up to Capitol, probably hundreds who would come to Capitol Hill and will actually testify and will go to their legislator's office and express to them their desires and their need for this medication.
This is an election year. Are you going to bring hundreds of people up to the Hill when you try to move this bill through committee? Is that one of the ways? Are you going to try to do that this year during this session?
I'm bringing this bill before the Senate Health Committee. I will invite everybody to come up, and I think we'll get a really, really strong turnout.
Now, in your op-ed piece about medical marijuana, you said your bill is an effort to strike a balance between, and I'll quote here, evolving public policy, constituent wishes, and constitutionality.
Right.
Now, that sounds also a little bit like that debate we had this week up on the Hill in a House subcommittee about same-sex marriage versus traditional marriage. Do you support the bill that was turned down in committee earlier this week that would basically uphold traditional marriage and not allow same-sex marriage in Tennessee despite the Supreme Court ruling?
Right. I actually did not read the bill, but in general principle, now I think the government needs to focus on education, on things like bringing commerce to Tennessee and being efficient, and so other issues are not really in my scope of focus at this point.
State Senator Dr. Steve Dickerson is our guest on Inside Politics. Our conversation continues on the other side of this break. Stay with us.